Hello, my name is Dr. Alex Holston, and I have the privilege of presenting the Centers for Medicare and Medicaid Services Qualified Health Plan, also known as QHP, Directory Pilot Demo on behalf of the Center for Consumer Information and Insurance Oversight and the Office of Healthcare Experience and Interoperability. I'm currently displaying my title slide. The title is the CMS Qualified Health Plan QHP Directory Pilot. My next slide is titled Introducing the CMS Qualified Health Plan QHP Directory Pilot with Oklahoma. The Centers for Medicare and Medicaid Services announced a first-of-its-kind pilot program to establish and implement an automated one-stop shop statewide centralized directory, also known as the portal, for the test state of Oklahoma that allows qualified health plans, or QHPs, and providers to submit and access pre-populated individual provider, organizational, and facility data to improve accuracy and reduce burden. The lessons learned from this pilot may help CMS explore the design and feasibility of a national directory of healthcare, which will build on feedback received in response to an October 2022 request for information. Why does this matter? On my next slide, titled Why This Matters, Long-Term Gains, there are 4 long-term gains that CMS hopes to achieve by implementing a national directory of healthcare. The first, reduce provider burden to eliminate providers from hearing from multiple plans to make updates and update info with every plan. Second, a streamlined system experience. The goal is one place to update provider data, supporting information exchange, leading to improved accuracy for consumers. Third, improve provider and payer efficiencies by saving provider time with one place to update, and then provide automation of those efforts to payers. And fourth, consumer benefits, better patient access to accurate data. As a note, the Oklahoma pilot portal will not be consumer facing. There are 4 types of users in the QHP directory pilot. My next slide, titled QHP Directory User Types, lists those 4 users. First, there are individual providers or providers that are healthcare professionals affiliated with a qualified health plan and practicing in Oklahoma who hold a Type 1 NPI. Second, those are organizational administrators or individuals who represent healthcare organizations such as clinics, hospitals, facilities, and other Type 2 NPI entities that practice in Oklahoma. Third, there are delegates, which are third-party administrators or designated staff who manage provider records and organizational profiles on behalf of individual providers and/or organizational administrators. And fourth, there are issuers. These are QHP issuers who will use information from the portal that they can then display for providers on their own consumer-facing websites. My next slide is titled User Expectations. On the left is a column that describes user obligations. On the right is a description of the user roles and where those are managed. User obligations are as follows. Users are required to update changes to their provider data promptly, but within at least 30 days of change. This supports health plan compliance with the exchange requirements for qualified health plans and Section 116 of the No Surprise Act. In addition, users are required to verify the accuracy of all data every 90 days. When logging into the Qualified Health Plan Directory Pilot portal for the first time, users will review and verify their pre-populated information. The previous slide discussed user roles. On the right, under user roles, is an explanation that user roles and permissions are managed through CMS INA, which manages access to the National Plan and Provider Enumeration System, known as MPES, that issues NPIs, and the Medicare Provider Enrollment Chain and Ownership System, known as PCOS, to manage staff and authorize others to access their information. Once user roles are assigned within CMS INA, they are immediately reflected within the QHP Directory Pilot portal. If you're having issues with your NPES credentials to log into the portal via CMS, you can obtain more information at this web link shown below, which is https://npes.cms.hhs.gov/ia web. My next slide is titled Logging In, Getting Started. Before accessing the login page, you must accept the privacy and security notice. On the right-hand side of my slide, I'm displaying what that privacy and security notice looks like. At the bottom of that security notice is a blue button with the word accept that I can click when I've read through the privacy and security notice. You can open the portal at https://qhpdirectorypilot.cms.gov. On the homepage, as discussed, you'll read the privacy and security notice, then click the blue button with white letters called Accept. My next slide is titled Logging In, Entering NPES Credentials. On the left are words describing the process. On the right is a screenshot of what that screen will look like. The instructions are, 1, when you are on the login page, enter your NPES credentials for user ID and password. This is the same user ID and password that you use to log into NPES, which is where your NPI is issued, or into CMS INA. Underneath the entry for user ID and password, there's a statement that says, I understand the QHP Directory Pilot will store personal identifiable information. Please click the checkbox to the left of that statement to acknowledge it, and then click the blue box with the words login in it to log into the system. Underneath the login button in blue are the words forgot user ID and password, which can be clicked if you're having trouble logging in or do not remember your user ID or password for CMS INA, NPES, or PCOS. After users log in, they're going to be taken to a multi-factor authentication page. On this slide, titled Logging In Multi-Factor Authentication, on the right side of the screen, I'm displaying a screenshot of what that multi-factor authentication looks like. And on the left is text walking through users on how to navigate through multi-factor authentication. On the multi-factor authentication page, select your preferred method, either text, call, or email, to receive a verification code. Click Send Verification Code. Using your preferred method, retrieve your verification code, and then enter that verification code into the verification code box, which will appear on the next screen, and then click Verify Code. Let's now transition to the Qualified Health Plan demo. For demonstration purposes, this is not the active Qualified Health Plan pilot directory, which users should be able to access at this time. This instead is a CMS test Qualified Health Plan directory demo, which does not contain any actual PII or PHI, but does have a similar experience. When I first log into the QHP plan directory, we see the privacy and security notice in the middle of our screen. We can read that notice, and then at the bottom, click the Accept button in blue, which turns yellow when I scroll over it to click and move forward. By doing this, it takes me to the next screen, where in the middle, I'm asked to enter my NPES credentials to log in. There are 2 fields where I can enter my user ID and password, which I do. Underneath the user ID and password entry fields is a statement that reads, I understand that the Qualified Health Plan directory will store personally identifiable information. There is a box to the left of it that I can click. And by clicking on that box and entering in my user ID and password, the button titled Login appears in blue, which allows me to click on it. I know that I'm able to click on it because when I scroll over it, it turns yellow. Also on the screen are links to learn more about how the Qualified Health Plan Directory handles PII. I scroll over that link, which is located in the middle of the screen, and clicking on that would take me there. In addition, beneath the login is a link that users can click on that reads forgot user ID/password. And beneath that is questions. Contact our help desk at QHP Directory Pilot at cms.hhs.gov. Having completed entering my user ID and password, and having clicked on the box next to my PII understanding, I can now log in. I'm taken to the multi-factor authentication screen. In the middle of my screen, I have the option of selecting either to receive an email at my email or receive a text to my personal cell phone. I'm going to have the verification code sent to my personal cell phone. I change the the radial circle selection to receive a text at my cell phone and then click send verification code. Verification code sent pops up on my screen. And as I wait for my text to come up, I can click OK on the box on the right-hand bottom side of that screen. I then have the option to enter the verification code, which I type into a box that appears in the middle lower half of the screen with the title Enter Verification Code above it. After typing in my 6-digit verification code, I click on the box that reads Verify Code. Sometimes, especially with cell phones, it requires the verification code to be resent again if it's not completed in a timely fashion. I'm going to resend that verification code. And verify it immediately. In the upper right, a box popped up that said login successful, and I'm taken to the Qualified Health Plan Directory Pilot landing page. The landing page is divided into a number of sections, and I'll walk you through it now. In the center of the landing page, if you're an individual provider, meaning that you are responsible for your own Type 1 NPI, you'll see your name displayed, and currently the page is displaying my name. You'll then see your NPI number, and this is not an actual NPI number for me. This is used for testing purposes only, as well as the last time I verified my information, and then a reminder that I have 90 days to verify my information again. The date that is 90 days in the future is displayed next to the Verify By section. To the left of this, there's a reminder that we want to verify the information accuracy promptly when changes are made, but at least within 30 days of the change, and to verify the accuracy of all data every 90 days. There are words above this section to the left that indicate to the user that this is done to support health plan compliance with exchange requirements for qualified health plans in Section 116 of the No Surprises Act. Underneath those words is a link that I could click that explains what the Verify By colors mean. By clicking on the Verify By colors mean link, a box appears in the middle of my screen titled Verify By Color Explanation. It then goes on to describe that verifying good standing dates appear in gray, verify due soon dates appear in yellow, and verification due immediately, or meaning that it is over the 90-day window, appear in red. In the upper left corner of the web page are 3 horizontal lines stacked on top of each other. This is commonly referred to as a hamburger menu. And if I need further support or would like to read the FAQs for the Qualified Health Plan Directory, clicking on this hamburger menu brings a drop-down where I can click on the words FAQs and support to access the support page. Underneath this are the words log out and a symbol that indicates that by clicking this, I should be able to log out of the Qualified Health Plan directory. For users that serve as delegates of individual providers and/or are delegates of organizations, or are administrators of organizations, they're going to see two sections beneath the verification that they will see in the middle and the verified information accuracy, which I described on the left-hand side. Those two sections that they'll see are divided into organizations, which appears on top, and providers, which is a section that appears beneath the organization section. In the organization section will be columns titled Name, NPI, the number of practices associated with that Type 2 NPI, the date that information for that organization was last verified, and the verify by date, which is 90 days after the last verified date. In the last column, which doesn't have a title, there's a button that can be clicked that clicks verify that will take users to the organizational workflow where they can modify and verify the information or in the record of that organization. At the bottom of this section, users have the option of clicking on a link to view all organizations that the user has access to modify and verify. The next section is titled Providers. Here is a list of providers that users serve as the delegate of. Similar to, but displaying different columns, this section has a column titled Name, where the provider name appears, then a column titled NPI. Next is the primary specialty, followed by the last verified date, indicating when was the last time that this record was verified, as well as displaying the verification by date, which is 90 days in the future from the last verification date. Similar to the organization section, on the far right is a button that I can click that upon clicking will take me to the individual provider workflow, where I can verify and update provider information. At the bottom of the provider section is a link titled View All Providers that I can click on to take me to a list of all the providers that I can update as a delegate. Scrolling back to the top of the screen, I again bring to the center my own personal information. Here I see my name, my NPI, my last verified date, as well as a button in blue titled Verify that when I scroll over turns yellow. By clicking on this button, I'm taken to the individual provider workflow where I can update and verify the information for myself. When I open this page, on the left, in bold, I'll see my name displayed, Dr. Alexander M. Holston, with my credentials, MD. Beneath this are 5 sections: contact information, demographics, professional profile, practice locations, and a review and submit button. By clicking on any of these 5 different sections, I'm taken to that section where I can update information within that section. Let's first look at contact information. By clicking on contact information, I'm taken to the contact information page of the record. In the middle of the screen, titled Contact Information, I can see my name, phone number, email, professional mailing address, and tax identification number. I'm given the option to edit the first 4, name, phone number, email, and professional mailing address. If I click on Edit, I have the option to edit my prefix, first name, middle name, or middle initial, last name, and suffix. Since this is correct, I'm not going to save it. I'm just going to cancel. My phone number, which I use for professional correspondence, is correct. My email is correct, so I will not edit that. However, for demo purposes, let's assume that I'm moving from Rockville, Maryland to Oklahoma, where I'll begin practicing. And my new address is 1200 Children's Drive, Department of Neonatology in Oklahoma City, in Oklahoma, with a fictitious zip code. By clicking Save, I can save that address into my contact information. There's words at the bottom that remind users that any edits are temporary until final submission at the end of the workflow. I have two options to get to the next section entitled Demographics. I can either come back to the left-hand side of the screen and select Demographics, or I can click the next button in blue at the bottom right of the screen. I chose to click the next button at the bottom right of the screen. Here, my demographics are shown with the title of Demographics at the top of the screen, and then 5 categories: sex, ethnicity, race, birth date, and languages spoken. All of these are correct and don't require me to edit them. Of note, users are unable to update birth date. This is because it's kept in sync with NPES and PCOS and CMS INA. There's also the words here to indicate that there's private information, which is the birth date. And we note to users that birth date will not be shared publicly. And to correct errors, users are directed to the NPES FAQs for correcting any information that we are pulling from NPES. On the previous screen, I'd also like to note that my tax identification number, also known as my Social Security number, was also read-only. As I scroll over the read-only part of this, a box pops up that says this is a read-only field. If the information is incorrect, contact the National Plan and Provider Enumeration System, NPES, the system that manages NPI records, at 1-800-465-3203, email customerservice@npienumerator.com, or visit NPES's website, https://npes.cms.hhs.gov. I clicked back to demographics and then click the next button to take me to my professional profile section. As we've been discussing, certain parts of the pilot are read-only to ensure that information stored here is kept in sync with NPES and PCOS. When I click on the professional profile section, the title is displayed as professional profile, and there are 5 areas that I'm supposed to review and update as able. Those are NPI Type 1, my primary specialty taxonomy code, my secondary specialty, if I have one, my credentials, and my state license. Users will note that NPI Type 1 is read-only as discussed. As I review my primary specialty, it is correct, neonatal perinatal medicine physician. But if it was incorrect, I could click Edit and scroll through the nearly 500 different specialty types that a provider could be listed here. Since it's correct, I'm going to cancel. I could also add a secondary specialty or specialties at this time, but since this is my only primary specialty, I won't. My credentials are correct. However, my Maryland license is not going to be as useful in Oklahoma, so let me add my Oklahoma license. Don't forget to add the expiration date, as the user or system will not allow you to save this information without it. After adding my Oklahoma license, I click on the next button on the bottom right of the screen. Here at the top is the title Practice Locations, the 4th and final section of the record that needs to be updated. I'm immediately greeted by a button in white with blue letters that, when I scroll over, turns to yellow. And this button is titled Add a Practice. If the practice displayed here is not the correct practice, and I need to add a practice, or I have a second or third location where I'll be practicing, by clicking on Add Practice, I'm taken to a screen that pops up from the right-hand side of the screen that's titled Add a Practice. And there I'm instructed that I'm able to search for a practice by typing in the practice name or an address. My practice is already displayed, so I will click the X button in the upper right to close that screen. My practice, fictitiously, for demo purposes only, is Sacred Heart Department of Neonatology. And here I'm able to review the office address, which is correct, the phone number, the specialties I practice at this location, which are correct. But if they weren't correct, I could click on Edit and press the drop-down arrow to pick the correct one. Now, I only have one primary specialty, so I'm only given the option to select that primary specialty. Providers with 2 or 3 specialties might have different combinations of specialties they practice at a location and should indicate those specialties by selecting the appropriate checkbox here. Because I don't need to change the specialties practiced by myself at this location, I click on the Cancel button and am taken back to be able to review the record. The next section is titled Days this provider is available at this location and currently displays variable schedule, which is correct. If I wanted to change this, I can click the Edit button, which takes me to a screen within the workflow that displays the days of the week. Because variable schedule is highlighted, I'm unable to select Sunday, Monday, Tuesday, Wednesday, Thursday, Friday, or Saturday. And when I scroll over each of these checkboxes, a little no sign appears in gray. If I were to uncheck variable schedule, it removes that no sign and allows me to check the boxes next to each day of the week. However, I do have a variable schedule at this location, so I check variable schedule, the box next to the title variable schedule to indicate that that's my selection and click Save. The next section is called Care Delivery Method for this provider at this location. This is where providers can indicate if telehealth services are provided at this location. By clicking on the Edit button on the right-hand side of the screen next to the title Care Delivery Method, I'm taken to a drop-down box where 4 options are presented: in-person care only, telehealth only business address, telehealth only home address, and in-person care and telehealth. For the purposes of this demo, as a neonatologist at Sacred Heart, I practice in-person care only. But if I had a business practice where I practice telehealth only at a business location, I could click the business address. If I practice telehealth through my own, from my own personal home address and did not want that home address to be shared, I could click telehealth only home address. And lastly, if I practice a hybrid model where I do both in-person care and telehealth from a location, I could select this, in-person care and telehealth. Since it already displayed in-person care only and no changes are needed, I'll click the Cancel button. The last section of the practice locations asks for patient acceptance status for this provider at this location. Underneath this title is a link that says, what does patient acceptance status mean? This link is displayed in blue with underline, and as I scroll over it, I'm able to click on this link and a pop-up titled Patient Acceptance Status appears, describing the 4 different options of insurances, of what accepting new patient statuses mean. First, insurance not accepted means the provider does not accept the selected insurance plan. Second, accepting existing patients only. This provider is only seeing existing or established patients. Accepting new patients mean the provider is currently welcoming all new patients and is available for scheduling appointments. And then accepting new patients with limitations. This is when providers are accepting new patients, but only under specific conditions, such as by referral. This is also used for family members of current patients, or they're only accepting specific age groups, either pediatric or adult patients. In this section is a list of all the qualified health plans, both medical and dental, that are in the state of Oklahoma. There are 3 columns. First, all networks. Second, medical networks. And third, dental networks. The user can click on either of those 3, all networks, medical networks, or dental networks, to indicate and list the networks as appropriate under that section. Because I practice in a medical office, medical hospital, in a neonatology unit, I'm going to mostly focus on medical networks. And because I accept new patients, and I'm always accepting new patients once they're born, I have indicated that I accept new patients for all of the qualified health plans. Because I'm not a dentist, I don't currently accept any dental plans and have, within the dental networks, and have indicated that I'm not accepting this insurance for all dental networks. Given that I changed nothing, I can click the cancel button. At the bottom of the screen in the bottom right is the words remove practice in blue. By scrolling over these words, it highlights that button in yellow. By clicking on it, if for some reason this practice was not a practice where I'm currently affiliated or working at and seeing patients, I can click the remove practice and remove the practice from my list. In the top right, next to Sacred Heart Department of Neonatology, is a button that I click to expand or hide all of the information we just discussed. By expanding all of the information, I once again review it, make sure it's accurate, and then click Next. This takes me to the final section, which is called Review and Submit. In this section, the title Review and Submit is shown on top, and I'm able to scroll through and see all 4 of the sections: contact information, which shows that I have updated my professional mailing address, demographics, professional profile, and practice locations. I make sure all of the information is correct as I scroll through until I get to the bottom of the screen. There, in the section titled Statement of Verification, I see a box that I can click that reads, I verify that the provided information is accurate to the best of my knowledge. 2 buttons display on the right. I either have the option of scrolling back through each of the 4 sections or clicking the Submit button, which is in blue. When I scroll over the blue Submit button, it turns yellow, and I click it, and success, submission successful, box appears at the top of my screen in green and then fades out. That's the individual provider workflow. Now let's look at how we update information for organizations. For the demo, I have 2 hospital systems that I am the organizational administrator for. They're displayed under the organization section, which I reviewed previously. I'm going to update the information and verify as appropriate the information for Sacred Heart Health. 2 organizations are displayed here in 2 rows, one Grace Sloan Memorial Hospital, and the second row titled Sacred Heart Health. I scroll to move my mouse to the right-hand side of the screen and click the verify button. When I click the verify button, we're taken to the organization workflow. The organization workflow should feel very similar to the individual provider workflow, with a few exceptions and changes. Instead of 4 sections, there are 2. The 2 sections are on the left-hand side titled Organization Overview and Practice Locations. The 3rd section, similar to the individual provider workflow, is titled Review and Submit. Let's start with the Organization Overview. The Organization Overview section, titled Organization Overview, appears in the middle of my screen currently. As I scroll through, there's a number of sections that an organization administrator could update if they so choose to make sure that the information was correct. The first is entitled Organization Name, which is correct for the demo purposes, so I won't change it. The next 2 sections, Organization NPI and Employer Identification Number, EIN, have a box on the right-hand side that says Read Only with a lock next to the words. When I scroll over Read Only, I'm reminded that certain fields, similar to the individual provider, are not able to be updated in the demo, so that the information here is kept in sync with the information that appears in NPES and PCOS. When I scroll over the box, a pop-up box appears that reads, this is a read-only field. If their information is incorrect, contact the National Plan and Provider Enumeration System, NPES, the system that manages NPI records, at 1-800-465-3203. Email customerservice@npinumerator.com or visit https://mpes.cms.hhs.gov. The same box pops up when I scroll over the Read Only button next to Employer Identification Number. Underneath this are fields that I can edit. Those fields are phone number, email, fax, mailing address, website, and patient portal URL. All of those are currently correct for this organization and no changes need to be made. At the bottom right of the screen, similar to the individual provider workflow, is a next button in blue with the word next in white letters. As I scroll over the next button, it turns yellow, allowing me to advance to the next screen. The next screen is titled Practice Locations. Here will be a list of all of the practice locations currently associated with that organization. For Sacred Heart Health, only one location is listed, Sacred Heart Department of Neonatology. As I open the information for that practice location, I'm greeted with the name of that practice location, Sacred Heart-Department of Neonatology, the physical address, office phone number, fax, email, website, services offered, language or languages spoken, accessibility accommodation, and hours of operation. Each of those fields has an edit button on the right side of the screen in those sections that would allow me to edit the name, physical address, etc. For example, if I wanted to edit the services offered, I could click Edit and expand the drop-down menu that lists all of the different types of facilities that currently exist within Oklahoma. Because I don't need to change the current selection, I click the Cancel button. If I needed to change the hours of operation, I can click Edit under Hours of Operation and change the hours when an organization is, when a practice location is open and when it closes, as well as the days of the week that it's open or not open. Since this is a hospital, I click 24 hours a day and 7 days a week and click Save. Beneath all of this, for each practice location is a section called Providers at this location. If there are providers who are affiliated with this practice location, you'll see their name and their NPI listed here, as well as the provider specialty that is practiced at that location. Of note, you'll notice that this is read-only. At this time, only individual providers are able to remove themselves or add themselves to a practice location. If the organizational administrator sees a practice location that is not correct, they are able to remove the entire practice location by clicking on the blue words at the bottom right that read Remove Practice. Once the organization administrator has reviewed all of the information under the practice location, they can click the Next button on the bottom right. This will take the organization administrator to the Review and Submit page. On this page, they'll see the organization overview section and practice location, allowing them to review the information that was just entered. The user is encouraged to scroll through and review each of the different practice locations and the organizational information for accuracy one last time. At the bottom of the screen, under Statement of Verification, is a checkbox that I can check that indicates I verify that the provided information is accurate to the best of my knowledge. In the bottom right, a blue button titled Submit turns yellow when I scroll over it. When I click the Submit button, I'm taken back to the home screen. When I land on the home screen, Success, Submission Successful appears in a green box at the top that then fades away. Thank you for attending our demo of the Qualified Health Plan Directory pilot. We showed you how to update information for an individual provider and how to update information for an organization. As a reminder, in the upper left of the landing page, under the 3 vertical lines called the hamburger menu, users can find a link to FAQs and support for any further help or needs. Thank you very much for joining us today, and I wish you the best.